Well, good afternoon, everyone, and welcome to our COVID-19 update briefing for Wednesday, October 28th. I'm joined today by Illinois State Police Director Brendan Kelly, who will provide an update from ISP on our election integrity support and our COVID mitigation enforcement. But first, our regular update. Today is the first day of additional mitigations in suburban Cook County and Metro East, with the City of Chicago following on Friday. And as of this morning, Region 9, Lake and McHenry counties has now sustained an average positivity rate of 8% or higher for 3 days, meaning that starting Saturday, they will join 7 of our 11 other regions in operating under resurgence mitigations. Region 9 is today seeing an 8.4% positivity average, up from 4.8% this time last month, and up from 3.1% in late June. Average COVID-related hospital admissions today are 5 times as high as they were in mid-June and 3 times as high as in mid-September. In other words, things are bad in Region 9 and getting worse. So beginning on Saturday at 12:01 a.m., public gatherings in Lake and McHenry counties will be reduced to 25 people, and indoor dining and indoor bar service will be temporarily closed, although outdoor service in tents or tented igloos and takeout, delivery, and drive-through service will remain available. We have made $220 million of business interruption grants available to any affected business. Applications for those grants for those businesses that are affected by these new mitigations are available on an expedited basis on our Department of Commerce website at dceo.illinois.gov. These resurgence mitigations aim to cut down on some of the highest risk activities until we bring down the positivity rate in Region 9 once again. As for Regions 2, 3, and 6 that remain free of resurgence mitigation measures, Region 3, which encompasses Quincy, Springfield, and much of west central Illinois, has now seen 2 days in a row of a positivity rate reaching 8%, meaning that a third day, tomorrow, would equal mitigations beginning in the region over the weekend if that happens. Region 6, east central Illinois, today has seen its first day above 8%, and if the trend continues, the area can expect the same mitigations as its surrounding regions. Region 2, which stretches from Kendall to Rock Island County and includes Peoria, is today at an average positivity rate of 7.7%, up from 7.2% on Monday. I know this virus is very hard on everyone. The damage COVID-19 is doing to people's lives and livelihoods is real. And for many people, the fight has gotten harder as the months have passed. Despite what the stock market looks like, the real economy for real people has been brutalized by this virus. And the Republican-controlled United States Senate has refused time and time again to give workers and those unable to work and local governments and small businesses the kind of support that they need. Many cannot financially survive this pandemic without help from Congress and from the President. The same, of course, is true about the health of Illinoisans. If we aren't able to bring down the number of cases and the rate of transmission, not only will our economy continue to suffer, but many more people will be hospitalized. Some will end up with long-term health consequences, and too many will die. This battle isn't going away by itself. We have to manage our way through with tools that we have available to us. And there are many of those tools that nearly everyone in our state has available to them to join this fight. First and foremost, to stay healthy, you should be wearing a mask when you are with people that are not in your personal family pod. Keep 6 feet of distance from others, even when you're wearing a mask, and frequently wash your hands. With the virus on the rise, you can stay safe by avoiding unnecessary gatherings. Don't host parties or attend them. It's hard, I know, but your home is only as safe as the people that you bring into it and your confidence that they've been wearing their masks and have been following the rules to stay safe. I have always maintained enormous faith in the people of Illinois to do what's right for each other. Our state government has always relied first and foremost on educating people about the dangers of the virus and about the rules to maintain public health. State Police Director Kelly and Public Health Director Dr. Ezike would say the same thing I just said. From the beginning, we have used encouragement and education to get businesses to follow the best public health guidance of our time. When a region is seeing seriously concerning rates of community spread, temporarily halting indoor, in-person eating and drinking operations has been best practice, not just here, but around the world. Why? Because the scientific research proves that these are the activities that frequently cultivate exposure and spread. The Centers for Disease Control and Medical Research have made that clear. So far, the Illinois State Troopers have worked hard to educate people about safety measures in dozens of counties across Illinois, working with local law enforcement, public officials, and health departments to urge the compliance that we need in order to get things under control so that we can, in fact, resume more normal operations once it's safer. But as we've unfortunately learned during this pandemic, some business owners refuse to get educated or just don't want to follow the rules, thereby putting their patrons, the public, and their workers in danger. Sometimes educating people isn't enough to get them to do the right thing. The state police have ramped up random checks of businesses that are subject to mitigation rules to identify those that aren't following them, and they've begun progressively taking more stringent action to hold scofflaws accountable. Director Kelly will talk about what that looks like in just a few minutes, and I've asked Liquor Control Commission and the Gaming Board to do the same. Local officials have a responsibility in this work as well. They are obligated to take action to keep their communities safe and to carry out the laws and regulations that are on the books. When state and national public health experts and their own local public health departments tell them things in their city, their town, and their county are getting bad, that more people will get sick and die if they don't take action, their job as a local elected or appointed leader is to lead, no matter how loudly a minority of people may criticize them, no matter how big a personal challenge that may be. Indeed, most often that's what separates good leaders from bad ones. The people of our state and our responsible business owners in our state rely upon local leaders to enforce public health guidance and hold bad actors accountable. Although I could rattle off a whole list of the incredible local leaders who have stepped up over the last 8 months to do the right thing to keep their fellow Illinoisans safe, there are also plenty of examples of local officials setting a bad example, refusing to believe the science and misleading their constituents. Getting beyond this pandemic, getting more kids into classrooms, and keeping our businesses open isn't going to happen sooner or safely if leaders are ignoring the virus or telling people they don't need to wear a mask or hosting gatherings that can turn into super spreading events. That's not leadership. With that, I'd like to turn it over to a great leader and someone that I'm very proud to work with, Dr. Ngozi Ezike. Doctor.
Thank you so much, Governor. Good afternoon, everyone. Today we are reporting 6,110 new cases of COVID-19. And that report, we also have over the last 24 hours, 51 additional deaths reported to IDPH. To date, 389,095 total confirmed cases have been reported in Illinois, and 9,619 total deaths. In the hospital overnight with COVID-19 were 2,861 individuals. Of those, 600 were in the ICU and 243 were on ventilators. In the last 24 hours, 70,752 tests were reported for a total of 7.4 million tests. I would like to give yet another shout out to our hardworking local health departments. It is our local health departments that are on the front lines, tracking cases in their jurisdiction, investigating outbreaks, and supporting individuals who have indeed tested positive. These dedicated staff are working around the clock to protect all of us. And one of the ways they are protecting us is by enforcing the mask mandate and an emergency amendment to the Control of Communicable Disease Code. That amendment calls for a notice of noncompliance to be issued to a business if they are in fact in violation of the masking requirement. If the businesses do not comply, it is then subject to penalties. Local health departments are also supporting law enforcement who are working to enforce the mask mandate as well. My hope is that enforcement is not needed because people will know that wearing a mask is the smart thing to do, it's the responsible thing to do, and that it will save lives. People talk about a mask mandate infringing on their rights, but I'd have to ask, do you have the right to put the health of others at risk? You don't have the right to spread a potentially deadly virus simply because you don't want to wear a face covering. But until people step up and take responsibility, I would like to ask for you to please help our local health departments by following the mitigation measures and following the mask mandate. Like it or not, we are all tied together. We are in this together, and we get through it or not together. We will get through this, so let's work together now. Thank you, and now I'll repeat comments in Spanish. Buenas tardes a todos y gracias por estar con nosotros hoy. Hoy informamos 6,110 casos nuevos de COVID-19 en Illinois para un total de más de 389,000 casos confirmados. Desde ayer se informaron 51 muertes adicionales para un total de más de 9,600 muertes. 2,861 personas en Illinois pasaron la noche en el hospital con COVID-19. De ellos, 600 pacientes estaban en la unidad de cuidados intensivos y 243 pacientes estaban en ventiladores. Más de 70,000 pruebas de COVID-19 fueron hechas por un total de más de 7.4 millones. Me gustaría dar las gracias a todas las personas que trabajan duro en la salud pública, de los doctores y las enfermeras a los primeros responderos, especialmente a los trabajadores de los departamentos de salud locales. Ellos están en primera línea rastreando casos, investigando brotes y apoyando a las personas que han dado positivo. Ellos nos ayudan a entender lo que está pasando por todo el estado, perteneciente a brotes y educación sobre la importancia de usar cubrecaras. La gente habla de un mandato de máscara que infringe sus derechos. Pero lo que yo diría es que no tiene derecho a poner en riesgo la salud de otras personas. No tienes derecho a propagar un virus mortal simplemente porque no quiere usar una máscara. Pero hasta que las personas den un paso al frente y asuman la responsabilidad de sus acciones, me gustaría pedirle que sigan las medidas de mitigación y el mandato de usar cubrecara. Aunque les guste o no, estamos todos juntos en esto y solo lo superaremos trabajando juntos. Muchísimas gracias para su apoyo And with that, I would like to turn it over to Director Brendan Kelly of the Illinois State Police.
Good afternoon, everyone, and thank you, Governor, for your continued support and words and actions for the Illinois State Police, and thank you, Dr. Ezike. Before I get into today's topic, I want to touch briefly on the upcoming election. At the direction of the Governor and with the guidance of our State Homeland Security Advisor, Alicia Tate Nadeau, and in cooperation with our partners at the Illinois National Guard, General Richard Neely, and the Illinois Law Enforcement Alarm System, ILEAS, the Illinois State Police prepared a multi-pronged plan to assist local and federal law enforcement agencies in safeguarding the election process and keeping communities safe following the election. We've been planning for months, including participating in readiness exercises with our state and local partners. Since its inception, the statewide Terrorism Intelligence Center has supported elected officials with information sharing and analysis of security events. In collaboration with our federal partners, STIC serves as a hub for sharing election-related matters. In the days leading up to the election and the election day itself, STIC is and will be in daily contact with the Election Information Sharing and Analysis Center and the Multi-State Information Sharing and Analysis Center. This elections partnership this year has been expanded to include members of the Illinois Attorney General's Office and the 3 United States Attorney's offices within Illinois. This work creates shared situational awareness within Illinois and monitors the nation's activities that implicate Illinois. Information that is Illinois-centric regarding threats to voters or the voting process, threats to election infrastructure, organized group threats, individual actors, as well as nation-state activity will be shared with local and federal partners and with the public as appropriate. Moreover, the Illinois State Police will support state, local, and federal partners as needed with threats to public officials, bomb threats, suspicious packages, and other serious criminal investigations that could be related to elections. The ISP will also be conducting high-visibility patrols during the election period to assist local law enforcement with any election disturbances at polling places or boards of elections. Also, the ISP will have extra personnel available should they be needed, including those from specialty positions across the department. And of course, we are doing this all during a worsening pandemic. The Officers Down Memorial page, which tracks law enforcement deaths, indicates that nearly 130 members of law enforcement have died from COVID-19 since this began. So none of us are immune. And since the beginning of this pandemic, the Illinois State Police and our partners have continued to do our part, first and foremost by setting a good example, wearing masks, practicing social distancing as much as our missions can permit. Through constant communication with local law enforcement, local health departments, and the Illinois Department of Public Health, we have focused on our community caretaking role to educate and improve compliance with IDPH regulations that keep people safe. Voluntary compliance is always our focus and has always been the Governor's direction. We've received referrals and complaints and worked with local health departments, local law enforcement, and the IDPH in 37 different counties and multiple health regions to promote compliance. The overwhelming majority of these referrals have resulted in compliance after education and a conversation or by action from local health departments. Since the General Assembly Joint Committee on Administrative Rules met in August, the ISP and other local jurisdictions have had an enforcement mechanism of last resort when all other efforts are unsuccessful, which can lead to a misdemeanor citation. Those emergency rules are focused on businesses, not individuals, and specifically on the requirements of masks and social distancing. Those emergency rules provide for an incremental process when those masking and social distancing requirements are not being observed by a business. That begins first with a verbal warning, followed by a written warning and a written order, and then finally, as a last resort, the issuance of a misdemeanor citation to the business, not to an individual. Let me be clear. No one is arrested. The governor and no one in law enforcement has ever suggested that as a possibility in the circumstance where a misdemeanor citation has been issued. It's where the emergency rule requirements for masking and social distancing have been outright and openly violated by the wait staff, cooks, business owners, and others refusing to respect or observe these basic safety measures. So far, citations have been issued in 5 counties. Again, compliance is always the goal, no more, no less. We know that patience is wearing thin. However, please keep this in mind. The forensic evidence we collect and analyze every day to solve violent crimes and put dangerous offenders behind bars is all based on science and the scientific method of trial and error. The comms, computers, intelligence, vehicle safety features, non-lethal and life-saving technology that has revolutionized law enforcement in the past 100 years are all based on science. While I have been at the hospital bedside of my officers that have been shot or struck or injured more often than I'd like to remember, I've seen with my own eyes and been so grateful for the medical science used by doctors and nurses to care for them. That medical science saved some of their lives. That same medical science gave some family the extra time to say goodbye when they couldn't be saved. So as the science of COVID-19 evolves, so too must all who serve. And next time my glasses fog up because of my damn face mask, I'll remind myself of the miracles of medical science and that there are smart people who are just trying to save lives, including those of my own people. So the men and women of the ISP are going to keep getting the job done, as they always do, while washing hands, social distancing, and wearing our masks. Governor, thank you, and I'll turn it back over to you.
We'll start with questions from online today. Chris Carter from WAND News is asking, Region 3 and Region 6 have reached the 8% positivity rate. Region 3 has 2 days of an increase. Do you have intentions of taking action and enforcing new mitigation in either region anytime soon?
We've been clear about what the metrics are for each region. When they trip those metrics, whether it's related to positivity rate above 8% for 3 days in a row, or positivity rates rising consistently 7 days out of 10, or again, consistency in hospitalizations rising, those two working together, that when those metrics are tripped, mitigations are put in place.
Rich Miller at Capital Facts is asking for you or Dr. Ezike. The Restaurant Association is calling for a return to 25% capacity. Your original plan for mitigation tier 1 was 25% capacity limits. Why was that changed, and why is 25% off the table? I think that's referring to Region 4.
Yeah, so let me begin by saying that we have the same metrics for every region, and they have worked. When we put them in place for Region 4, when we put them in place for Region 7, they were in place for a period of time. When we kept bars and restaurants indoor service closed for a period of time, those regions emerged from those resurgence mitigations as a result of that. That will work. That does work. And when it doesn't, then we have to ratchet up a little bit. That's happened in Region 1, of course. But unfortunately, I will say that we have urged local governments to take action before we ever have to take action. We've encouraged local governments to, when they see their positivity rates going up, to impose mitigations that they think will work, and to prevent us thereby from having to impose other kinds of mitigations. Many times those local governments have not chosen to do that, and then we've had to step in and take action. So as far as I'm concerned, the mitigations that we've been putting in place in regions have been working, and we intend to stick with that.
Matt Roy at WICS. The question is for you, Governor. There has been over $6.4 million paid out in overtime compensation to IDES workers in the first 9 months of this year. One employee has worked over 1,300 hours just themselves. Will more people be hired to help with this overtime and overwork problem?
Well, two things to keep in mind. We have been hiring all along here. It does take time to bring people on, to train them and get them on the phones, which is most often where we're putting them. And then don't forget that we've brought on outside contractors as well so that we could bring hundreds and hundreds of people on board even before we could get them through a process of bringing them on board on a permanent basis at IDES, and we're going to continue to work on that. We're slowly working our way down, bringing down the backlog that has existed in certain categories of unemployment claims, and we'll continue to do that until we get it completed.
Jerry Nowicki from Capital News Illinois is asking, state police say that they've only issued citations in 5 counties. As many business owners push back on restrictions, how can we achieve the same widespread buy-in for mitigation efforts as we saw in the first wave without consistent enforcement?
Couldn't agree more. Local government leaders are, in fact, ultimately responsible. Local law enforcement, the laws that are on the books, the regulations that are on the books for the state of Illinois are the responsibility, at least enforcement for them, are the responsibility of local leaders, local law enforcement. We use the state police where we need to use them. As many of you know, there are fewer, let's say, sheriff's deputies or police in some areas of the state, and that's where state police have been very, very effective. And there are some areas where local leaders are not doing what they need to do, and that's where state police have come in handy.
Christine Tressel from ABC7 asks, we have various groups asking for the data and metrics on restaurants in cases of COVID. Everyone keeps asking what the data specifically shows. CDC studies, they say, are too broad and not specific to what is happening in Illinois.
So let me begin by saying that we have 97 local public health departments in Illinois. Some are more technically proficient than others. And so it's taken us some time to work with those departments to get them up to speed working on the same system so that they're reporting into the Illinois Department of Public Health all of the data in all 97 of those public health departments. Remember that there are 2 sets of data that, and we'll be putting that up on our website. We've done a good job, I think, of working with those 97 local public health departments. We'll be putting that data up in the coming days. Probably by early next week, it will be up. Exposure data, that's one set of data, and outbreak data, that's another set of data. I want to be clear with everybody that contact tracing gets you mostly exposure data. It's, you know, when you call somebody who is a case, somebody who has tested positive, and you get from them information, what you're getting is who have they been in contact with, in what locations, from the time, typically 14 days before somebody is tested positive to 2 days after they actually took the test when they would find out that they're positive. We're collecting as much data as we can from them. What that typically reveals is where there's been exposure. So all the places that they were at and the people that they came in contact with. So that's what contact tracing data is really all about, exposure data. And you would see, for example, if you look at the data, and we've shown some of that data to you a couple of weeks ago, that many of the listed places in which people come in contact with one another are either private homes, private gatherings, or in bars and restaurants. There are a few other places listed as well, but those are near the top of the list in exposure data. Outbreak data is a little bit different. We'll be putting that information out too, and that typically is where we can trace 2 or more cases to a place where we, that is sourced at a single location. For example, what we're looking for, because the contact tracing data doesn't tell you where somebody caught it. In fact, there's no way really to know where somebody contracted COVID-19. What we can try to determine by, again, cross-referencing the data is where have people been together at the same time, or where have there been multiple people that are spending time, some period of time in a location. And that can be labeled as an outbreak location. So you'll see that data as we come forward with it, but it'll be in the next few days or early next week.
Jim Haggerty at the Rockford Advocate is asking, with COVID-19 cases increasing across the country, how much better is Illinois prepared to handle the second wave as opposed to when the virus first started spreading in the state?
Well, I don't know if you recall that at the very beginning of this pandemic, we, as you remember, we didn't have enough PPE to even cover our first responders, let alone, as you saw, the healthcare workers and frontline workers who badly needed it while we even had a stay-at-home order in place. So are we much better off today? Oh boy, are we better off. We have stockpiles of PPE that we've acquired over time. We've distributed that. Every long-term care facility has PPE delivered to them. Every public health department has PPE delivered to them. We make sure and distribute PPE wherever we can. That's one example. There are many others. Remember that early on we had very few tests. I think we were one of the first states to get the original test to even try out in the state of Illinois. We only had a couple of hundred in the first week or so. We now are administering over 70,000 typically per day on average, and all across the state. So, I mean, are we better prepared? We sure are. That doesn't mean that we can stop the virus. It means that with the virus present among us, we at least can diagnose people. We can make sure that people have PPE, and especially masks. People can wear masks. If you can't afford a mask, we provide masks to lots and lots of places where you can get one for free. And people should wear them, please wear them. So there's a lot that we've learned from the very beginning, and I think we're much, much better prepared for this wave. Having said that, this is a tremendous wave. This COVID storm is apparently covering the entire nation. We're going to do our best to stay the best in the Midwest. We're going to do our best to bring our numbers down as fast as we possibly can. That's what the purpose of the resurgence mitigations is.
Winnebago County Health Department has guidelines that allow for restaurants to have some indoor service at bars and restaurants as long as they take reservations and people make their information for contact tracing available. Is this a plan the administration supports?
No, that's not something that's supported, and in fact, it's prohibited under the resurgence mitigations that have been put in place for Region 1.
Dave Dahl at WTAX is asking, just to name one, Congressman Darren LaHood has said he's taking his kids to Indiana to play soccer. Countless other parents are doing similar. What do those parents know that you don't?
Well, I can just tell you this, that if you look at the positivity rates and the case numbers by population in the states around us, where Darren LaHood is taking his kids, you would see that there's a much higher case count. There's a much higher, at least, positivity rate. And in fact, I think I read that Indiana has taken away all of its mitigations. And as a result, it's experiencing some of the same problems that Wisconsin is seeing in terms of hospitalizations and positivity rates. So we don't want to get there. That's not something I would suggest that any parent should do to their children, to expose them to very high rates of cases or positivity.
Kelly Bauer from Block Club is asking if there's any more information available about the youth who died in Cook County. What age was he or she? Any underlying conditions?
I'm not aware of the Cook County youth. Are you, Dr. Ezike? Okay, thank you.
So we do know of a recent passing of a teenager in Cook County who is not known to have had a past medical history, who did succumb to this COVID-19 infection. Again, this occurred last week.
Treasurer Roberts is asking about the IHSA board's decision that's just coming out now, allowing sports and basketball to continue in the upcoming season. This goes against your recommendations. What are your thoughts? Is this acceptable?
Well, let me first say that what we're listening to is the guidance that's given by national organizations, the guidance that's given by physicians, particularly those that treat children, and of course the experts in sports medicine. And so, what I would suggest is that if there's a difference of opinion, I prefer to err on the side of health and safety, and I think that's where we have intended for all of our guidance to fall.
All right, we'll take one more.
Okay, I have two questions if you let me.
Sure, go ahead.
About basketball, but
Sure.
that's off the table. Mayor Lightfoot said that you two met today for an hour, and she says, other metrics should apply because, yes, cases are up in Chicago, but hospitalization rates are not, that they're down. and she was asking you for in-person dining. She says she's not gonna pursue litigation or a TRO, but where do you stand on that? Have you budged it all after your meeting with her?
We had a great meeting, and, the mayor and I talk frequently, and, we're always very frank with one another. You know what our resurgence mitigations are, and we're going to, we put them in place in each region as they trip those metrics, as we will in the city of Chicago. And then, I'm sorry, there was a piece of that you asked about some specific
Well, she just is,
area.
sure that the family gatherings, if people aren't eating in restaurants, they're gonna be, forced to get food to go and possibly have more people over in their house. And according to her, that's the #1 spread of COVID is family gatherings in Chicago. According to the.
Yeah, it's the #1 across the country. We're literally hearing that from the CDC and from public health departments across the country, is that many people are having private gatherings in their homes, and that is a significant source of spread. As we know, bars and restaurants are also a significant source of spread. These are all facts that we agree upon. I think that what everybody understands is that we should do everything that we can. People should understand, as I said in my remarks, that having a gathering with people at your home that are not part of your personal family pod is taking some level of risk. And so, #1, please, people should wear a mask. Right? I just want to remind everybody, because I know it's tempting. We're friends with somebody. And you think that, well, my friend isn't going to give me COVID, right? And they don't mean to. They would never mean to. Or your family member that you invite over who doesn't live with you and has a life outside of yours. We're just trying to educate people, as we always have. And then to the extent that we can limit interactions in places where we know there's spread, that's what we're trying to do, especially in the midst of a COVID storm that's hit the state and the nation.
And back to that breaking news from IHSA, you're not going to try and stop them? Because they said that it'll be up to each school district to decide if they're going to play basketball.
Well, we've told school districts what the rules are, and I think they all know. IHSA may have their views of it, but school districts know what the rules are, and I think that, it's unfortunate, but they would be probably taking on legal liability if they went ahead and moved, beyond what the state has set as the mitigation standard.
All right, thanks, everyone.
Director Kelly, Director Kelly, one question. Yeah, go ahead. What's your role going to be now?
I think it'll be as I described today, and I think it'll be the same as we've done, frankly, since the beginning of the pandemic, with a slight difference than that occurred as a result of the emergency rules that passed, went through the JCAR process, that again, that provided a very focused instrument of last resort, where frankly what we're seeing in most of these circumstances, and I think this is how it will play out in most of the regions of the state, where you just have, unfortunately, you have some business owners, you got waitresses, waiters, cook staff, they're just outright refusing to wear masks. And right now that's just kind of gross. And it's definitely a way to spread this disease. And when we've gone through that educated process and sought voluntary compliance, following the emergency rules as they require us to do, the very incremental process that requires education, which requires a verbal notification, then a written warning. If at the very end of that you still don't have compliance, and even if it's a decent compliance and it's imperfect, you still have that process. That's usually what we're seeing when the misdemeanor citation is issued, and then that process goes forward with all 102 different state's attorneys that we have in this state.
All right, thanks,
Thank you.
Are you going to go in, if they're not supposed to have in-person dining, are you going to go in there and ticket them? Or give them a warning to shut down?
It's the process I just described to you.
Okay.
Yep.
All right, thank you
Yep.
very much.
Yes, ma'am. Thank you.